Services Department and a former senior health advisor in the Obama-Biden White House. Ms. Johnson worked on strategies to fight the Ebola and Zika epidemics as a member of the White House Domestic Policy Council's health team, and is now focusing on expanding testing in schools, nursing homes, and other settings, and for high-risk populations that have been hit hard by the pandemic. I know she has about 15 or 20 minutes with us, so I want to let her have some time to speak, and then she can hopefully take a few questions. Carole.
Terrific. Thank you, Dr. Benjamin, and thank you, Susan, for the invitation to be here. I was so delighted to get Susan's invitation because it just gives me a chance to start by saying thank you to everyone on this group for the incredible work that you've done over the last year and a half now as it's approaching. Your tireless efforts have made a huge difference, and we're so grateful for that. But it's also my job to ask us all to double down as we try to meet the president's goal of ensuring we get 70% of the population, of the adult population, at least one vaccine dose before July 4th. And so we're all working aggressively to do everything we possibly can to make that happen. I know you are as well. And so we appreciate your efforts. If you have new ideas for us, additional ideas for us, we're open to all good thoughts as we try to do everything we can to help people get the information they need to make an informed decision here and get vaccinated. I wanted to spend some time this afternoon talking about a couple of things. One, I wanted to lead with just a very brief conversation about the importance of equity to our COVID response efforts. And so equity is the lens through which we see all of our work, and you'll see that in our vaccination efforts, in the Shots at the Shop initiative that we just announced to really work on partnering with African American leaders in the community on our initiatives to try to address childcare needs of individuals who need vaccination, on the data analysis that we're laser focused on ensuring that we get equitable distribution of vaccines. So I wanted to just share with you, because I know that's a key priority of this group, that it's a key priority of ours. And all of our work is informed by that. And we look forward to working with you. And again, your ideas and thoughts on ways that we can continue to advance that work are most welcome. I also would be remiss if I didn't mention testing. So testing remains a critical part of our overall strategy. As you know, there remain people who are either their children, many children are not yet eligible for vaccination. There are people who are still making decisions about vaccine. There are folks who are vaccine hesitant for a host of reasons, and we're working hard to reach them together with you. But testing is going to be very, very important as we work together to continue to ensure that we have the diagnostic capacity to identify disease outbreaks early, that we're able to intervene early and do that classic public health work of contact tracing and mitigating outbreaks, and that we're screening in higher risk settings and creating that kind of confidence in reopening that testing can help to provide. And so we've made a number of investments thanks to the American Rescue Plan in expanding access to testing. We're going to continue to focus on testing and making sure it's readily accessible. But I know that today's topic is really focused on the public health workforce. And I see many friends on this call who I know have spent years working hard to make the goal of expanding and modernizing and doing what we need to do to make the public health workforce what it needs to be for not just pandemic response, but for day-to-day health and well-being of Americans a priority. And as you know, the president shares that goal. And so it was, as you heard him talk about during the campaign, and then as you saw in the proposals for the American Rescue Plan, the president has been really focused on ensuring that we learn the lessons of this pandemic and that we also build for the future. So earlier last month, we announced the first tranche of funding from the American Rescue Plan focused on the public health workforce. And with those resources, we really hope to do two critical things. One is getting resources and capacity to public health departments and community organizations now for the critical needs that they're facing in the immediate, including staffing vaccination sites, doing the really high touch vaccination outreach that so many communities are doing, continuing to support testing and contact tracing and data analysis and the critical laboratorian work and epidemiology, and making sure that we are doing the things that we need to do for frontline public health to bring this pandemic to an end. But also making sure, and we heard this repeatedly from leaders across the field, from local public health and state and national leaders and community organizations, that we need to not just be thinking about the immediate term, but thinking about the long term here. And that it was critical that we have a pathway for not just ensuring that states have some confidence that resources are there so they'll make the investments, but also to create some career pathways in public health. So we sort of take advantage of this critical moment when so many young people are raising their hands or paying attention to what's happening in public health and seeing career opportunities there, that we need to think about what those career ladders and career pathways can be. And so the $7 billion, the more than $7 billion investment that we announced last month does a couple of things. One, it includes direct resources to states with the ability to subgrant to locals to support a range of public health roles, including school nurses at a time when adolescent vaccination is coming online. And we hope in the future that there's vaccination for younger children, really helping to build up the school nurse corps is going to be an important part of our strategy, but also helping to, in the short term, really fund, in the short term, meaning over the next couple of years, really fund the all those critical frontline public health workforce, and to do, the community outreach and to do vaccination and to do testing and to do all the things that we talked about. In addition, that initial tranche of funding includes dedicated resources for disease intervention specialists so that we can think about and public health professionals can really develop a professionalized pathway for contact tracers as we think about all the many people who've come into the workforce and the workcorps through contact tracing. Can we create a professional pathway for them to do sort of that contact tracing, case management, outbreak response, investigation work going forward? Those resources, that original, that first tranche of resources also will support the creation of a public health Americorps, where CDC and our colleagues at Americorps are going to work together. Again, this is really a place where we're thinking about taking advantage of all the energy and enthusiasm amongst young people for really getting involved in public health, and can we bring them into that experience through an Americorps pathway, and also utilize the sort of boots on the ground capacity that Americorps can give us as we're doing all this intensive work related to outreach. Those resources also will expand a number of the signature CDC training programs. So the Epidemic Intelligence Service, a number of the laboratory fellowship programs, a number of places where CDC has basically built some professional development opportunities to take people who are younger or mid-career and really help develop their skills and expertise so that people can go back to their states or go elsewhere and really bring that specialized expertise. So those resources are sort of the first tranche. That altogether is about $4.4 billion of the more than $7 billion investment. Then what we have said is that over the next several months, CDC will work together with the public health community on developing a longer term $3 billion initiative, a new grant program that will think more holistically about how to facilitate federal investment in state and local health, public health, and modernize the public health workforce for the future. It is sort of notable that CDC really hasn't had a dedicated program for investment in state and local public health. There are pieces of things in various places, but there isn't sort of a holistic program. And so the American Rescue Plan resources will help develop that, and it will allow CDC to think differently about funding, who they fund and how they fund them, rather than sort of just funding kind of the traditional jurisdictions, funding those jurisdictions, as well as funding more directly to local public health, which hasn't always been an easy thing operationally for the agency to do. And for all of these initiatives, what we've said is that awardees will really be asked to prioritize recruiting individuals from the communities they'll serve and from backgrounds that are traditionally underrepresented in critical public health functions, so that we start to not only start to build and rebuild a public health workforce, but that we build a public health workforce that's reflective of the communities that they serve, and really have and continue to build community trust with all of our critical work. Because as you all know better than I, the important work on the ground here is really ensuring that people are responsive to our public health messaging, and really that we get to a healthier and stronger nation, with the critical role of public health being at the forefront of that. So that's what we're hoping to do. Several of these initiatives have begun or are on their way to being underway in terms of resources getting out to states. But the larger initiative, the $3 billion initiative going forward, will really be a collaborative process, because we want to make sure that we are hearing from the public health community directly about the needs and what modernization sort of looks like there. So with that, I will turn it back to you, Dr. Benjamin, and thank you for the opportunity to be here today.
Carole, thank you. You have a few minutes for a couple of questions?
I do.
Okay. Well, there's one in the chat about testing asymptomatic elementary school children. Recognizing we won't be able to vaccinate them until probably the end of the year, maybe the beginning of next year. What's your thinking about that?
Yeah, that is actually something that we have invested in early. So we've announced a $10 billion investment from the American Rescue Plan to state health departments to support testing in schools, in K-12 schools, for the purposes of helping to identify asymptomatic infection in particular, but also doing diagnostic testing as needed, because we recognize that will be a particularly important population to have access to testing because they will be among the only populations that don't have eligibility for vaccination yet. So, those resources are with states. Several states have moved forward in terms of releasing RFPs and trying to bring testing online. A lot of states are also, taking advantage of CDC TA to kind of work through what they're going to do here. But a lot of things are underway with states and school districts right now to help implement that.
And my president, Jose Ramon Fernandez Pena, has asked about AHAX. Obviously, the AHAX system is out there, and one of its original goals was to help improve workforce. Is there any specific funding to go to AHAX?
Yeah, so it's an interesting question. I will say we have not, although this $7 billion investment is close to the number for the total public health workforce investment in the American Rescue Plan, it is actually a combination of workforce dollars and some testing dollars that are supporting some of the DIS roles. So there are resources that remain available in the public health workforce allocation from the American Rescue Plan. And we are talking to agencies like HRSA and CDC about what additional opportunities. And so I will take that back. Thank you for raising that.
Thank you. And of course, this is a broad coalition of really folks that are, in many cases, all these organizations have people that are actually out in the field. How can we be helpful to the administration? Any thoughts about that more specifically than you've already shared? Well,
I have to say thank you for offering. I hope that all of your organizations are members of the Community Corps, which is an effort through HHS to really ensure that all community-based organizations are plugged into our latest messaging and our latest outreach strategies and updated communications from some of the clinical leaders like Dr. Murthy and Dr. Fauci and Dr. Walensky and the like, as we are working through our month of action here. So I hope that your organizations are signed up there. If you're not, please do so, and I'll make sure after this call to get the right information to Susan so folks can get signed up. But it's really a terrific way to stay plugged into all these efforts, and frankly, for us to hear what you're doing directly, so that we can continue to advance best practices in vaccination. And then beyond that, I would say we benefited enormously from many of your organizations sharing with us your white papers or other work that you've been doing with respect to workforce development over the years. And that was really helpful to the agencies as they were thinking through this work. And so to the extent that you all have done that kind of consensus building or thinking and have papers and other work, that's always incredibly helpful to us.
Thank you. I know a couple more questions. The issue of trying to get health informatic training and people doing health informatics into this workforce, are they an eligible group?
Yeah, that is among the eligible groups. I recognize though that is a challenge. I mean, as you mentioned at the top, I came back to DC in this role, formerly having been the commissioner of the Human Services Department in New Jersey, and man, was hiring technologists, hiring people with those kind of skills it was hard. It was hard to do at state GSA type rates. And so we recognize that that's an ongoing challenge, and we really want to work with you on those kind of issues. I've heard folks talk about, strategies for using regionalization and things like that. And I think that we just want to make sure that we have an open dialogue with you on those issues. I also will say, one of the other investments we've made from ARP is in genomic sequencing, and in the genomic sequencing funding, there's a lot of work to go on related to building out the cloud-based infrastructure for genomic sequencing and the like. So I think that's another opportunity to think about this workforce. So I would say we're thinking about it in all the various ways that it interacts with our goals here, but recognize that that's a hard one.
Well, just maybe a couple more questions. I know your time is short. Schools of public health, what is the role for those schools in this process?
Oh, well, there's no bigger fan of schools and public health than me. I think that we've got, you all have the untapped resource, or the tapped resource, frankly. We've all called on schools of public health over the last year and a half, but thinking about how we best recruit and how we align as states develop their plans for implementing these resources, how that best align with how public health schools are doing their work, I think would be a really useful thing, and really and to have the state planning really informed by the schools of public health would be a really important tool as well.
And then I guess finally, the public health laboratory workforce.
Well, we're excited about the fact that the $7 billion announcement that we made included several components related to the laboratory and pipeline. We, in the same way that I noted on bioinformatics, we know that building out the laboratory and pipeline is really an important part of ensuring that we have the public health workforce of tomorrow that we need, and that we can do the work we need to do to get where we need to be with respect to this pandemic. So high on the priority list.
And then finally, I forgot to ask this one. There's this whole issue of how do we go from, a lot of people are going to be bringing in some workers that are kind of part-time or early workers. What we really want to do is we want to figure out how we do this and build this capacity for the long haul. So some of these dollars obviously will go towards workers that are, they're going to help us get over this initial crisis. But what's the administration thinking about how we transform this for the long haul?
Yeah, that is the key question, and one that informed all of our work in putting this together. We could have sort of just taken the ARP money and put it out on the street for the immediate needs, but it wouldn't have gone very far, and it would have, I think, also not been as it would have been frustrating, I think, to the public health community to see sort of short-term dollars. We all know that short-term discretionary dollars are helpful, but they are certainly not, they certainly don't address the sustainability question. And the sustainability question was front in our mind here. So that's why we've thought about these initial investments to help really surge what we need for the pandemic, and then building out this $3 billion longer grant program, so that there's a pathway for those individuals that are coming on now or came on throughout the course of the pandemic in more short-term roles. It's also why we're investing in the disease intervention specialist role, because we think that we can take advantage of the training and experience that the contact tracers have now to bring them into more longer-term roles. So we've thought in these dollars about short-term and long-term, and we've thought about the fact, frankly, that states and locals need to be able to hire with an eye towards the future, and are gonna hesitate to hire if it feels like it's just short-term money.
Carole, listen, thank you very, very much. We appreciate your time today. I know your time was short, and I wanted to make sure we had some of those high-level questions, and now we're going to roll up our sleeves and kind of delve into this a little bit. And you're welcome to stay as long as your schedule allows. We are going to do a quick poll of our group here today, and to just kind of get a sense of what they're thinking the priorities are. So you might just want to stick around for the next 60 seconds or so and see what that poll is going to show.
That's terrific. Thank you for that. And thank you again to everyone for the invitation to be here today. I'm really just delighted, and I really look forward to continuing to work with everyone. This is obviously a topic that is really important to the president, and we're anxious to work together on it.
Great. So I think I turn this back over to you, Susan, for there's the poll. So you can answer as many questions, you can check off as many boxes as you would like. But this is just to give us a sense of your top concerns that you have today. And so if everybody would just kind of spend the next couple of minutes figuring out the boxes, this will be very important. And if you have any additional comments that are not in here, you can actually add them into the chat. Another 30 seconds or so, Susan?
Yes, we've got about 2/3 of the people who've answered.
Oh, okay, so a few more. Yeah, we have to figure out how we get Jeopardy music on these webinars. That's the next thing I'm gonna see if we can get Zoom to do.
So we're at 82%. How about 12 more seconds?
We have a note in the chat while we're talking about the non-governmental public health workforce. Caroline, thank you for your comments on that. The importance of getting those individuals, that particularly gets in, our focus on community health workers.
We're excited about new resources for public health workers, as well as new grant dollars we're doing to community-based organizations through a HRSA RFP that's out now as well.
Thank you.
And here are your results.
We're going to capture that and, of course, send that to everybody. So a little bit of everything. Wow, interesting. So diversity and inclusion, and then issues around funding. I'm assuming that includes how to responsibly spend these resources, and training seem to be the ones that broke 50%.
And thank you for including the working conditions and burnout. We know people have been working long and hard for a very long time now, and we need to take care of our workforce as well.
Excellent. Okay. Carole, thank you very much for your time today.
Thank you again. I really enjoyed being with you.
All right. So now we're going to spend a few minutes providing some additional context for our discussion to make sure we're on the same page. And so Susan, if you could bring up that next slide. And this is some of the information, of course, from the Public Health Wins study. And as you know, it showed that we certainly are having some real challenges with our workforce. And the fact that we've obviously, you see that little graph on the right, I think everybody's familiar that we've lost a substantial number of both state and local health officers. The WIN study looked at trying to enhance the training needs and try to identify what some of the training needs are for our workforce. And I would just encourage everyone to, if you haven't spent some time really dwelling into the WIN's work, this was very, very good work that we had as part of the public health workforce. Next slide. But in addition to that, we know the healthcare workforce is also a challenge. So just remind folks that doctors and nurses are being challenged as well. School nurses, big issue. And for my colleagues, Scott Becker and his colleagues in the lab, quite often we still staff from either side. Either they come from the clinical side and come into public health, or they go from public health and we lose them to the clinical side. They're having some real challenges getting the kinds of workers that they need, particularly health lab technicians, filled. And all of our workforce is down. Finally, the retirements that we've thought were going to hit us over the last 10 years are finally hitting. Some of that because people just have had enough and are ready to move on and do something else. Certainly some of them are aging out, but I think the big issue there is that a third of healthcare workers themselves are also thinking about leaving their professions. And mental health is playing a big role in a lot of this. And at a time, even though we have more mental health needs, the behavioral mental health workforce itself is also shrinking. Next slide. So I think as we're looking ahead, we've got a shortage in many types of professions that we're going to have to deal with. We know we want to make sure we have a diverse and representative workforce as we go forward. These new resources that we have are important, but there certainly are really just a drop in the bucket. $7.4 billion sounds like a lot of money, and yeah, it is a lot of money at one time. But we need to be into this for the long haul. And for those of you who have practiced public health at the state or local level, know that having the money and spending the money and having your elected officials committed to filling those both vacant positions and new positions remains a big challenge for us. So just something to think about as we do this, because I think there's a lot of concern that as we go forward, that these dollars be spent in an extraordinarily responsible manner. With that, that kind of update, let me turn to Angie. And I think Angie's going to help us have kind of a discussion on some of these critical issues. Angie.
Well, thanks so much. So we really wanted to spend this time mainly hearing from all of you all and really having a chance to learn about what's happening in the field. And really, we see our role as figuring out where we're going and also how we can really help with collaboration. So what we're going to do today is first talk about lessons about the workforce challenges and opportunities that have emerged during both the pandemic, as well as the workforce we need to end the pandemic, but also to really think about what's needed to accomplish these broad goals and to make sure that we really develop that strong, resilient public health system and promote equity as we need to. We have a couple colleagues who've agreed to kind of start off the discussion with us. And so we'll get going with that, but then really want to hear from you all. And so one thing we will do later is also, after we kind of have these different perspectives and people speak just a minute or so, we're going to give everybody a chance, if you'd like, to raise your hand with the little icon on. If you can go to the next slide, Susan. Thank you. So logistically, we'll do kind of the regular raise your hand with the Zoom feature after we kind of talk to the few folks who've been nice enough to agree to chat with us. And then would ask you all to keep it to about a minute. So really the highest priorities you see. And everybody, please also feel free to use the chat function. So if there are resources you'd like to share, if there are comments, we're going to capture all of those and we'll return them to you later. And you also, if it's something that you can add to the chat feature, feel free to email it to our Alliance email or to me, and we'll make sure that all gets captured. With that, once we're done with this, we'd ask you all to be thinking about how we can collaborate and work together. And we're going to divide up into small breakout sessions to give everybody a little bit more chance to really think about everything we've heard and hopefully move on from there. So if we can go, I think the next slide may. Nope, sorry, last slide is great. So I have the pleasure of introducing the first of our quick panelists, and it's Oscar Espinosa, who's the Director of Research and Evaluation at NNPHI. And he's going to tell us about a little bit of work that they've done recently with Kresge, looking at the field as a whole, that we thought would be a great place to start things.
Good afternoon. Thanks, Angie. Appreciate it. And good afternoon. My name is Oscar Espinosa, and we recently, as Angie mentioned, conducted a review of the literature to look precisely at challenges and opportunities for strengthening the U.S. public health infrastructure. And I see some of our experts that participated in that process. So some key, very quick takeaways is that, yes, we already heard about severe shortages in epidemiologists, public health nurses, physicians. We also heard about information technology and the need for experts to help with interoperability and cybersecurity. These are issues that are very complex and do require technical staff that, as Carole mentioned, go beyond GSA rates. So that's a big issue. Also, when we were doing our scan, we ran across the reasons why these shortages were occurring. A lot of them were presented by Dr. Benjamin. I just wanted to add the threats and attacks on workers came up quite a bit. So fearing for one's personal security and stress and overwhelming responsibilities and work came up quite a bit as well. In terms of strengthening or looking for solutions, one thing that Carole mentioned, we found as well, the need to create those career pathways to make it very easy for new potential public health staff to see themselves working in public health is very important. And so we saw some literature for ideas to incentivize even middle school teachers to begin introducing public health in their lesson plans, offering public health enrichment programs in high school. RWJF had a very successful young epidemiologist scholars program. So adding those types of programs, offering public health work to those in community colleges and even in high schools could help with community health workers and all the work that they're doing now. Also doing paid work practicums and mentorship programs that pair high school and community college students with public health workers came up quite a bit. What was recurring was the strategic partnerships that need to take place between universities and local health departments. So again, to Carole's point, so that students could see themselves earning a living in public health is very important, and reinforcing that with those paid work practicums is going to be really important. And then just wanted to leave you all with a final thought of the how do you compete for with the for-profit sector for those IT jobs. As I mentioned, cybersecurity came up quite a bit, and the need for interoperability. How do you solve that at the local public health level? Those were some issues with very, very few solutions.
Great. Thanks so much, Oscar. And I don't know if you wouldn't mind putting a link to the report in the chat feature. That would be great.
I sure will.
People can check it. Thanks.
Thank you.
Great. So after that, we wanted to turn a little bit to focus some on equity, and that Denise Smith can tell us a little bit about the role of community health workers. And so Denise, I will turn it over to you.
Sure. Good afternoon, everybody. I bring you greetings from Hartford, Connecticut. My name is Denise Octavia Smith. I'm a CHW, a patient navigator, and the founding ED of the National Association of CHWs. Oscar, thank you for the presentation and for the work that you all are doing. And Georges, thank you for just creating the space. Angie, thanks for the invite. So in February of this year, NACHWA released a national policy platform. This is for public and private institutions to do three broad things: to respect the CHW workforce, to protect the CHW workforce, and to partner with the CHW workforce. I'm going to put the link in the chat. It's several pages, and I want to just voice over a couple of things that I think are incredibly urgent to maximize on this moment of the infusion of dollars to make it a movement for health equity and sustainability of the workforce. A couple of things that are most urgent and that are really lessons learned from the first year of the pandemic. Number one is to center authentic CHWs and the full range of CHW roles while eliminating barriers. It is very much the case that in the early months of the pandemic, CHWs were actually being laid off from federally qualified health centers and health departments because their supervisors, program managers did not always understand the extent to which their shared life experience, their trust, their cultural competency could actually be leveraged and pivoted or adapted to address the pandemic. So these folks were sent home. Another common theme was, where are CHWs? I don't know how to find them. I don't know where to find them. Oftentimes we saw that recruitment really mismatched to who people were actually trying to reach. So when you embed barriers like requirements to have a bachelor's degree, requirements to have your own vehicle, you are setting up your own recruitment process, perhaps to go against the very individuals who have the embedded community trust, shared relationship, and cultural relevance that you're seeking. The next item that I want to mention is to direct funding, capacity building, and partnership to the assets that are already present in your local county or state. And I have to emphasize this because many organizations working at the state level were not even aware that there were CHW networks, associations, and coalitions in their state that they could partner with for recruitment. Many of these member associations have been around for decades. They provide training and mentoring, career placement, apprenticeship programs, policy and advocacy. If you know them through work on your state innovation plans, your state innovation models, other initiatives to expand the ACA marketplace. But these folks are here and they comprise part of the community-based infrastructure that these dollars need to tap into. Please recognize that we need direct funding and partnership to these organizations. You can't bring folks to the table and understand that they don't have the capacity to bring their resources and expertise to bear on these initiatives. So I think that's really important. I want to lift up the issue of governance. These are, after all, tax dollars. And here I just want to reference my own experience and history as an HIV outreach worker. The Ryan White Consortium model is very appropriate here because funding, design, development, intervention, implementation, evaluation, and monitoring all was conducted with those who are most impacted at the table. That was a requirement to have cross-sector experience and cross-sector perspectives, as well as persons living with HIV/AIDS. This is no different. When you are developing community interventions, when you're creating pipelines that are supposed to be reaching deeply into the community, you want to make sure that you're reaching diverse CHWs, persons living with HIV, persons who've experienced homelessness, youth workers, cancer survivors, folks who are working on social justice. So have a cross-sector lens so that you have reach and so that we can really drive equity in this process. I think that that's critical. And then finally, I just want to say, as we think about pivoting to sustainability, bringing all of your state partners to the table, Medicaid directors to the table, bringing folks who are thinking about long-term state innovation and state health improvement plans so that the training, the recruitment, the roles of these short-term hires can begin to pivot to longer-term initiatives that are going to address the disparity and inequity in your state. We do not want broad recruitment of diverse community members who are often some of the lowest paid in public health when we talk about CHWs to have a grant funded job for 6 months, a year, 18 months. We've seen that for decades, and CHWs have already evidence of their effectiveness for over 6 decades. So NACHWA looks forward to partnering with you. If any of these resources or concepts are not readily available, please do reach out. For local or state level partnerships, we'd be happy to help. And thanks so much, Angie, for the time.
Thanks, Denise. That was great. Now I'm going to turn to Katie Sellers from De Beaumont Foundation, who's going to tell us about a couple of efforts that they know of. And I know Katie spent a lot of time looking at the workforce, so I thought she'd have a great perspective.
Thank you so much, Angie, and thanks everybody for your attention. I will make this super brief, but I do just want to start by endorsing everything that Denise said, because I absolutely believe with all my heart that respecting, protecting, and partnering with CHWs is critical at this moment as we are trying to build a better, more effective public health workforce. That's how we're going to do it, and it has to start with that respect. So thank you, Denise, for everything that you do. I have 3 things that I want to highlight really quickly. One is the Public Health Workforce Interest and Needs Survey, which Dr. B already mentioned, and I so appreciate the use of that data, but that data, it's getting old. It's 2017. We really wanted to update it last year, and we couldn't because everyone in public health departments was really, really busy, too busy to take our survey. So we are going to be conducting PH Wins again in 2021. If you don't already know, it is the kind of one and only nationally representative survey of individual workers in state and local health departments. And we do it every 3 years or so, although we did have a hiccup with COVID. I wanted to mention it partly just to give you a heads up that it's coming in the fall. We'll have data the following spring. So it'll be spring 2022 when we are able to give you new data. But now is the very last moment. If you have burning questions that you absolutely think we need 50,000 governmental public health workers to answer, now is the time to let us know. So you can email us at phwins@debeaumont.org, and I'll put that in the chat. If you have ideas about questions we could ask these individuals in the health departments. And that's something we do in partnership with ASTO and others, and really appreciate their partnership on that. The second initiative I want to highlight is called Staffing Up, and this is something we're doing in partnership, especially with FAB and the Public Health National Center for Innovations. And this is where we're coming up with an estimate of how many people the governmental public health workforce needs. And we're really using the foundational public health services framework as a guide for what the most basic services everyone should have access to in their jurisdiction. We'll be releasing this number at a national level in the next month or two, and then we're going to be shifting to work on more granular estimates that health departments will be able to use to make their staffing decisions. So let me know if you would like more information about that. And then the third one is called Public Health Forward, Modernizing the US Public Health System. And this is where we're really engaging a lot of different partners to think about what an effective, modernized public health system should look like, and how can we seize this current opportunity with all the money that the White House was just talking about to make sure that we really get there, instead of just investing in a lot of pandemic preparedness and getting rid of COVID. And so this is a partnership with ASTO and NACCHO and BCHC and FAB and Pew and the CDC Foundation and Kresge, Sunflower Foundation, Johns Hopkins, and the Bipartisan Policy Center. We are building on the previous frameworks that are out there. We know there are a lot. We're not trying to recreate the wheel, but we're really trying to lay out how that current funding that's available can be used to build that sustainable, effective public health system that we're all looking at. We're going to be focusing very specifically in 6 areas: equity, partnerships and community engagement, public health law, data modernization, the workforce, and financing public health. And so this is a very complex project that we're really trying to maximize involvement from across the field. You are all on this call going to get an invitation for something related to this project. That's part of the reason I wanted to tell you about it. It has an advisory council. It has a bipartisan task force. We're going to be broadly circulating a survey for input. We're going to be doing town hall meetings over the course of the summer and the fall. And then we're looking to put out a report in November. And I'm really hoping that that report will gather input from all of you and be able to put it together to influence that sort of second tranche that our speaker was talking about earlier, that one will hopefully be really informed by the public health field. So those are the 3 updates I wanted to share with you, and then don't want to take up too much of our time for discussion. Thanks, Angie.
Thanks so much, Katie. So now we're going to see how this works. So we're going to turn it over kind of to everybody. And so if you want to raise your hand, I'll give you, and I'd really ask people to stick with a minute because we don't have that long and there are a lot of you. So also feel free to use the chat feature. And so just want to see, are there questions specifically on what we just heard about, or are there issues that you want to lift up? I see there've been some great things in the chat around diversity, on data, on working with labs or others. So I will hand it over to folks to see who would like to go next. And I may call on people if I don't know a couple others of you have agreed to be willing to be on call if needed. Okay. Then I may call on somebody if that's okay. So Judy Monroe or Lauren from CDC Foundation, I know you all also are doing a lot of work in this space and just wanted to see if there were things you're seeing out in the field that you might be willing to give us a quick update on. And that'll give people a chance to raise their hand.
Sure, I can jump in with a few comments and then turn to Lauren to see what she'd like to add. Just a bit of a reality check. CDC Foundation early in the response hired CDC Foundation field staff to help with surge staffing. With all the funding going to the states right now, one of the things that has happened is, especially through their ELC funding, which is the Epi Lab capacity funding, jurisdictions are unable to hire. I mean, so the funding's coming, but they don't have the mechanisms. They either have caps on hiring or they can't move quickly enough. So they've turned to us as an intermediary, and the CDC Foundation is hiring on behalf of a number of states. We have agreements now with, I can't even count how many states where we're basically hiring for them. It raises the need for intermediaries at large across the nation. And so I just want to bring that up, lift that issue up in terms of a barrier to the funding, particularly coming so fast, but it's something that's been around. The other thing I'd comment on, in our experience, one of the things we've seen on a really positive note are many of the contact tracers that we did hire back over a year ago, and others that maybe had not thought about a career in public health are pursuing public health degrees and are quite excited. So it's consistent with what others have said, and we really do need that pipeline for those that could have long careers in public health. Another area I'd bring up is they talked about the pay disparities, and the issues, and we've run up against that. So as the CDC Foundation, depending on our funding source, we might be able to pay, and sometimes do, pay higher salaries than what a health department would be able to hire, since it's coming from the foundation. But that has its own problems. So example, like if you have a state that needs an epidemiologist that nobody will go to in a particular county, and we can maybe pay more, that still disrupts the pay scale at the state, which leads me to public health law and advocacy and policies. We really need in the workforce for the health departments, the strong advocacy and public health and policy skill set, and not just for where we need to go in the future to build this system, but to also fight against the erosion of public health authority and the threats to public health that are happening in so many states. And then the last thing I'd say, just to punctuate, we've all talked about data, the need for informatics and data, which is really front and center, but also skill sets that can work with the community-based organizations, with the businesses, with the hospitals. I mean, a lot of, and I think that was actually in the report that NNPHI did, where there is that need for the skill sets at the health departments to be able to work with many of those other sectors. Particularly, I think our local health departments have a need there. But Lauren, do you want to add from your perspective?
Judy, I think you hit all of the high points. I think I would just, emphasize the last piece that you were making about the experiences and skills and comfort with doing the kind of partnership or bridging partnership with different sectors that are going to be necessary to weave the kind of public health sort of fabric, strong public health fabric that's more than, as I think both Katie and Angie mentioned, more than just a response or to this pandemic, but more about that future state of a strong public health infrastructure. And those kinds of partnerships, and being, a lot of states and local areas do that already, but for some states and local areas, I think it's they really haven't had the opportunity to do it as much because they've had to obviously be focused so much on day-to-day work. So I think that would be really important. And infusing or incorporating equity into all aspects of that, not only into the things that are designated as equity projects, will be really important.
Great, thanks. So I'm wondering, I know we've heard a lot from kind of maybe our more traditional public health folks. I'm wondering, from those of you who are a little bit more healthcare focused or work with other sectors, are these common issues, or are there other things that you're seeing in hospitals and with your workforce that we also should be lifting up so that we can work better together?
Hey, Angela, this is Betsy, or Angie, this is Betsy Baker from AWS. I was just typing into the chat, but since no one popped in, I figured I'd just pipe up. So coming from a data perspective, when I think about health equity, when we dive into data, there are a lot of data points that are not collected, either because they're not required at the national level or at the state level, in order to really understand where the true health equity gaps are. So I'm just wondering if anyone has a perspective on how we can help drive some of those policies to help us collect the things that are needed to really understand the benchmark for where we're at right now. Yeah, I don't know if anyone has any thoughts on that. But I know that's a challenge for when we're trying to work with our customers on some of these things.
And Betsy, I don't know if we have an answer, but you're certainly getting people who agree with you. I see a lot of nods, and Karen even gave you a plus 1,000. So she clearly agrees. Anyone else want to jump in on Betsy's question? Okay, other things around data. Anything else that you're working on that you just want to make sure this group knows about? All right, then I think I'm going to give people a minute. But if not, I think maybe we'll go ahead, Asma, and divide up into our breakout groups, and then we can always capture some information there and come back. I see a lot of great things happening in the chat, so we could certainly lift up a couple of those too. Steve, anything that you think we want to come back to?
No, there's a question that actually transitions us into the breakout questions. Okay. So I think we're good.
Great. Okay, so everybody, so what's going to happen now is we're actually going to divide up into 3 breakout groups to make it a little easier, hopefully on ourselves. We're going to have